SPARK is an acronym for Strong, Positive, Active, Responsible Kids. It's a clinic for pediatric weight management.
We just focus on helping kids that are dealing with maybe gaining more weight than they should or having a heavier body size and maybe having some health issues because of that too. This is not a cosmetic program. We're not about diets and necessarily weight loss, but we're about changing our habits when it comes to what we're eating, what we're doing for activity. We have a team approach. You meet with me and I talk about the medical history of the patient, any medical problems they can be having because of their weight or their habits. You meet with a dietitian that really goes into in-depth talking about food and giving you advice and ideas. Then we have a physical therapist who talks about activity and just moving our bodies more. And then we also have a mental health therapist too to help work on changing our behaviors and changing our habits to be a little bit healthier.
There's no cookie cutter recipe for this, for treating obesity, and every patient is unique. So having a multidisciplinary clinic allows us to treat each patient individually.
Being able to take your vitamins okay. We know that earlier we start working with kids to make healthier habits, the better chance they have of preventing adult obesity. When we wait till kids are a little bit older, they're more set in their ways and their habits, and trying new foods and changing their ways is a lot harder. So we start talking about bariatric surgery when a patient's facing a lot of health issues because of their weight or their body size, and maybe they've attempted some diet changes, some different habits, some exercise changes, but they're not seeing a whole lot of weight loss, or at least not enough to improve the health issues that they have.
There's a small percentage that will need surgery, and it's important that that's part of the equation because it's very frustrating to go through all this hard work and not see really significant weight loss. And I think once you reach a certain weight, it's hard to do exercise, and so you kind of hit a point where surgery is probably the best option. But we hope that it's not used frequently, but when we do it, we want to do it very well.
Our goal is to help them deal with the current difficulties or problems that they're having, but also prevent many of the complications that were to happen down the road. We want to see them thrive, and that's why we do what we do.
It is the mission to me, just improving the lives of children, and that's exactly what we do. It's not your typical way of just throwing medicines and treatments at kids, but it's just let's establish a better lifestyle and this is a medicine you can use for the rest of your life.